So students, in this video we are going to discuss the miscellaneous drugs, miscellaneous diseases and drugs. Okay, so सबसे पहले let's discuss erectile dysfunction. Now erectile dysfunction is basically we know a disease in which there is difficulty in erection of the penis. Now the drug of choice in this is phosphodiesterase 5 inhibitor. So this phosphodiesterase 5 inhibitor will basically increase the cyclic AMP, cause vasodilatation and result in erection. The drug that is used now, the mechanism cyclic GMP is there, and this basically causes vasodilatation and causes erection, and this cyclic GMP is metabolized into inactive substances by phosphodiesterase 5 enzyme. So this cyclic GMP is then inhibited by the drug that is phosphodiesterase 5 inhibitor. Now why I'm writing tadalafil? Tadalafil because it is the longest acting and the most preferred drug as of now. Okay, now important points related to this. First, not prescribed with nitrates. It is not to be prescribed with nitrates because it can result in severe hypotension. Then another new drug has come, a new congener that is called as avanafil. Okay, so this is a newer congener. Then there is another new drug that is aviptadil. This is a VIP analog, and this aviptadil causes smooth muscle relaxation. So this is important about the erectile dysfunction. So now after erectile dysfunction, let's take up the treatment of obesity. So what are the anti-obesity drugs? Right, now in anti-obesity drugs we have lorcaserin, which is a 5-HT2C agonist. Okay, then there is a combination of phentermine plus topiramate, and this is basically contraindicated in pregnancy, so it cannot be given in pregnancy. Then there is orlistat, and this orlistat inhibits the absorption of fat, and so it causes a side effect, that is adverse effect is steatorrhea. Okay, then other drug that we have rimonabant. Now rimonabant is a CB1 receptor antagonist. Okay, it basically increases the 5-HT and dopamine and also decreases the BP. Then we have GLP-1 analogs, in which we have exenatide, liraglutide and semaglutide. Okay, then we have sibutramine, which was earlier used, and this basically decreases the presynaptic uptake of noradrenaline and 5-HT. Right, so these are the anti-obesity drugs. In short, we have studied about them. Then next we come to sickle cell anemia. Now in sickle cell anemia, the drug that is used is hydroxyurea. It basically increases the fetal hemoglobin production, and it also reduces it is used to reduce the pain crisis. Okay, then there is a drug which is called as L-glutamine. This reduces the oxidative stress in the body, and it reduces the acute complications of sickle cell disease. Then another drug is there, crizanlizumab. Okay, this is a monoclonal antibody that blocks p-selectin, and it reduces the frequency of sickle cell pain crisis. Okay, then there is a new drug, this is very important, that is voxelotar. Okay, voxelotar, this drug basically increases the hemoglobin, the oxygen affinity to hemoglobin, then reduces the hemoglobin polymerization, and also reduces the red blood cell sickling. Okay, so this is used to treat anemia, also decrease the sickle cell disease associated complications. Okay, so this is about sickle cell anemia. Next we discuss about the treatment of hyperkalemia. Now in hyperkalemia, what are the drugs used? In acute hyperkalemia, glucose insulin drip. This is a drug that drives potassium inside, so glucose insulin drip. Then beta-2 agonist, that is salbutamol. Right, then sodium bicarbonate. These are the drugs which will do what? They will drive potassium inside cell. And then there is a drug which is called as calcium gluconate. What does it do? It will basically prevent the ECG changes. Okay, now what is given in chronic hyperkalemia को कैसे control करेंगे? तो chronic hyperkalemia में we use loop diuretics because they will cause excretion or secretion of potassium. We can do hemodialysis, and we can also do peritoneal dialysis. Okay, so this is the treatment for hyperkalemia. They can ask you clinical scenario based questions on that. Then let's see the antidotes and poisonings. Okay, now antidotes and their poisonings. So here I'll write the poisoning and here I'll write the antidote. So in beta blocker poisoning, what do we use? We use glucagon plus calcium. Then okay, I'll write the poisonings first. OPC poisoning. You, in the meantime, you think what are the drugs which are used in these poisoning? Methanol, ethylene glycol, iron, paracetamol, valproate, atropine, heparin, warfarin, ergot, carbon monoxide. Okay, so these are some of the poisonings that I've written. Now let us see what are their antidotes. Okay, so beta blocker antidote is glucagon plus calcium. OPC poisoning antidote is atropine. BZT poisoning flumazenil. It is also for zolpidem. Cyanide poisoning we use either hydroxycobalamin or amyl nitrite. Then methanol is fomepizole. Ethylene glycol is also fomepizole. Then iron in acute we use desferrioxamine, and in chronic we use deferriprone. Okay, then paracetamol we use N-acetylcysteine, valproate we use L-carnitine, then atropine we use physostigmine, heparin we use protamine, in warfarin we use vitamin K, ergot we use nitroprusside, in carbon monoxide poisoning we use hyperbaric oxygen. So these are various poisonings and their treatment. These poisonings are here and their treatments are here, right? So this was a little bit on the poisonings. In the same line, we can also discuss the chelating agents. Heavy metal poisonings में जो use होते हैं. So BAL, what chelating agents in which the main chelating agent is BAL. Now BAL is also called as British anti-levisite, right? So this BAL is basically contraindicated in iron and calcium poisonings. BAL is used in the poisoning of bismuth, arsenic, lead, mercury and gold. These poisonings it is not used in iron and calcium poisoning, right? This is something that we have to remember. Then another drug that we have is calcium sodium editate. So this is again used in iron, can be used in iron, lead and cadmium poisonings. Then there is D-penicillamine. Okay, D-penicillamine is basically used in copper poisoning, which is also called as Wilson's disease or hepatolenticular degeneration. Okay, आयरन का हमने देख ही लिया है. Now आगे बढ़ते हैं हम. तो अब let's talk about drugs acting on skin. Let's talk about drugs acting on skin. So skin पे सबसे पहला we use are topical steroids. Okay, topical steroids में betamethasone is most potent and hydrocortisone is least potent. Okay, you have to remember this. Side effects, steroids के adverse effects होते हैं. They cause skin atrophy, which is in fact like cigarette paper skin. Then some stria, telangiectasia, purpura, these are the side effects. Then other agents that we would like to talk about for skin when we're talking about skin are retinoids. Now these retinoids are divided into first generation, second generation and third generation. So first generation में we have retinol, tremoin, isotretinoin and alitretinoin. Then second generation is acitretin. Third generation is tazarotene and pixarotene. And then there is one compound which is retinoid like. It is adapalene. Okay. Now these are potent teratogens. So contraindicated, absolutely contraindicated in pregnancy. Then side effects may they cause dry skin. They can cause nosebleed, conjunctivitis, alopecia and pseudotermon cerebri. Okay. Then tretinoin is used for acne vulgaris and also used as an adjunctive for aging. This is something. Now see, all these things are just, you need to remember them really. इसमें कोई concept है नहीं, इसमें कोई ऐसा नहीं है कि आपको कोई concept समझना है. You just need to remember all these drugs and indications. Okay. Now next, in the retinoids, tazarotene is used in psoriasis and acne. An important thing here is that tazarotene is a prodrug and it is activated. Then alitretinoin is approved for Kaposi's sarcoma. Then isotretinoin is used in severe nodulocystic acne. Acitretin is used in psoriasis, but it was withdrawn. Then bixarotin is used in cutaneous T-cell lymphoma. Okay, so these are some uses of retinoids. Okay, now there's something called as photochemotherapy. Let's see what is that. Now photochemotherapy is basically ultraviolet radiation. It is ultraviolet A, ultraviolet B and ultraviolet C. Now A is between 320 to 400 nanometer, B is 290 to 320 nanometer and C is 100 to 290 nanometer. Out of this, UVB is most erythrogenic and most myelogenic. Okay, now what is done, that what is PUVA? There is something called as PUVA therapy, which is actually 8-methoxysorelin. This is given oral plus ultraviolet A. And where is it used? It is used in vitiligo, in psoriasis and in cutaneous T-cell lymphomas. Okay, then it has got some side effects, that is nausea, blisters, erythema. It also increases the risk of melanoma and squamous cell carcinoma. So PUVA therapy is basically 8-methorelin plus ultraviolet A, that is given. Then there is something called as photopheresis. Now what is photopheresis? Now after oral methoxysorelin is given, then leukocytes are separated from whole blood using ECP device to them, that is extracorporeal plasmapheresis, and then the patient is exposed to ultraviolet radiation. Sorry, not the patient, the leukocytes, and then irradiated cells are returned to the patient, right? Now this therapy, photocell, is used for cutaneous T-cell leukemia. Then there is something called as photodynamic therapy. Now what happens in photodynamic therapy? It combines photosensitive drugs, that is porphyrins, with visible light for treatment of non-melanoma skin cancer. Okay, so these are the three types of phototherapies. One is the photochemotherapy, that is with the ultraviolet radiation, PUVA. Then there is photopheresis, in which cells are irradiated separately, and there is photodynamic therapy, in which photosensitive drugs are combined with visible light for treatment of the skin cancer. Okay, so this was about the phototherapy and other things. Then we have some other drugs which are basically other agents. Let's see them. So cholestasis associated pruritus. What are the drugs used in cholestasis associated pruritus? We use cholestyramine, ursodeoxycholic acid, ondansetron, rifampicin. Okay. Then we have pruritus of uremia, and the treatment is with UVB radiation. Okay. Then there is a drug called as capsaicin, which is used in post-herpetic neuralgia and painful diabetic neuropathy. Okay, so these are the drugs which are miscellaneous kind of agents. Then there's a condition called as age-related macular degeneration, right? You all must have heard about this age-related macular degeneration. Now this is of two types, dry and wet. Okay, now wet is neovascular kind of thing, so उसके लिए अलग से therapy लगती है. And dry is most common and it is untreatable. You can just give some vitamin supplements. Okay, now what are the drugs which are used in age-related macular degeneration? It is either photodynamic therapy, plus there's a new agent which is called as verteporfin. This is a radio sensitive material. Then anti-VEGF drugs, what are they? Pegatinib, okay, ranibizumab, then aflibercept and bevacizumab. Then there's a new drug, anicorvate, and this is an angiogenesis inhibitor. Okay, right? There is a condition called as Rotman syndrome, right? What is the drug of choice? Drug of choice is cyproheptadine. Then what is the drug of choice in scorpion sting? In scorpion sting, the drug of choice is prazosin. Okay. Then there is a substance which is called as calamine. Calamine is actually zinc carbonate plus ferric oxide. And when you make a lotion of this calamine, then you add zinc oxide also, plus you also add bentonite. So remember that calamine consists of zinc carbonate, ferric oxide and zinc oxide. Then sucralfate is used topically. Sucralfate otherwise is a peptic ulcer disease drug. It is used topically in burns, in bed sores. Okay. Then there are some substances which are called as astringents. Now what are these astringents? They basically precipitate the proteins like tannic acid, tannins. They are used in bleeding, gums and piles. Okay. Then there are some drugs which are called as keratolytics. Now these keratolytics, they are basically used in corn and pots, and they basically mainly consist of salicylic acid. Okay. Then there's a drug called as calcipotriol. This is used in plaque psoriasis. Okay. Then a new drug is there, apremilast. Apremilast is a phosphodiesterase 4 inhibitor, and this is also used in plaque psoriasis. Then there are some demelanizing agents. Now these demelanizing agents में आता है एक hydroquinone, which is a hypopigmenting drug. Okay, so this is used in melasma or chloisma of pregnancy. When chloisma of pregnancy is when there is some pigmentation on the cheeks of a pregnant lady, right? Then let's see some antiseptics, disinfectants and ectoparasitides. Now in this we have phenol, cresol. These are basically protoplasmic poisons. Okay. KMNO4, hydrogen peroxide, benzene peroxide, they are oxidizing agent and they are used in acne, also used in cleaning of wounds and removing the slough. Then there are some halogens like iodine, iodophores, chlorophores, right? Then there is something called as Mandel's paint. Mandel's paint. Now what is this Mandel's paint? This is basically 1.25% iodine dissolved with potassium iodide. This is Mandel's paint. In iodophores we have betadine, right? In chlorophores we have bleaching powder or hypochlorite solution. Okay? So these are the drugs. Then pediculosis, that is lice. So the drug which is used is permethrin, lindane. Okay? Permethrin is the first drug of choice. It is found to be very, very effective. And permethrin is effective both scabies and lice. Lindane is absorbed, so it is toxic, while permethrin is not absorbed from the skin. So it does not have any side effects, right? So this is important about the pediculosis. Then we have many insecticides. Now in insecticides, remember that we had some OPC and carbamates, right? Then we have some chlorinated hydrocarbons like DDT or lindane, right? And then we have pyrethroids, right? In which we have like drugs like alethrin, deltamethrin, etc. Now DDT basically acts on the GABA receptor and it acts on the picrotoxin binding site of GABA receptor. And lindane they are only for topical. Lindane is only approved for topical use in lice and scabies. Otherwise, it is not used, right? Then there are some rodenticides. Rodenticides are drugs which are used to kill rat kill. So rat kill, these drugs are basically what? They are anticoagulants. So they block the vitamin K dependent factors and the rat dies because of the hemorrhagic shock. Okay, if there's contamination in human beings, then vitamin K is the antidote for the rat kill or suicidal poisoning अगर होती है तो. ठीक है. Then other drugs that we इसी में, yes, we have some second generation compound which are called as superwarfarins. They are also used now. Then we have some drugs which are basically metal phosphides. इसमें आता है alphos and sulfos. What you have seen that in villages they keep these medicines in the grains. Now this sulfos, it causes release of phosphine gas, PH3 gas, on coming in contact with gastric acid or moisture, right? So then इसकी जो poisoning होती है, अगर treatment of poisoning is only supportive, we don't have any antidote for this poisoning. Okay. Then there are some herbicides. Herbicides are basically pesticides which are used to kill unwanted plants and weeds. And the drugs which are there are paraquat and glyphosate, right? Then we have some insect repellents, which is DEET and pralethrin, which are basically pyrethroids, right? Next important topic is food adulterants. Now इसके ऊपर कई बार questions आते हैं, so let us see them one by one. The first kind of poisoning that is seen is ergotism, which is due to ergot fungus, है ना? The second type of poisoning is argemone poisoning, which is called as epidemic dropsy, because the argemone, they resemble mustard seeds, and so because of this contamination, this poisoning is seen, right? Third is letharism. Letharism occurs because of consumption of kesari dal, and it is a neurotoxin which causes inability to walk. Then fourth is aflatoxicosis, which is because of a drug called as aflatoxin, and the toxin is aflatoxin and the fungus is Aspergillus flavus. This results in liver cirrhosis and ultimately patients develop liver cancer. Patients who are suffering from aflatoxicosis, they develop liver cancer. Okay. Now miscellaneous में अपन और आगे बढ़ते हैं. तो हमने स्कॉर्पियन स्टिंग देख लिया था कि वो प्राइजोसिन से ट्रीट होता है. नाउ हाउ इज डॉग बाइट ट्रीटेड? नाउ डॉग बाइट को इमीडिएटली पहले वॉश करना ज़रूरी है. देन टेटनस इंजेक्शन, देन post exposure prophylaxis of rabies. If it is category 3, when there is multiple wounds and the skin is also cut, then a rabies vaccine has to be given immediately, plus rabies immunoglobulin have to be infiltrated at the site, at the injury. Then if it is type 2, that is moderate, then rabies vaccine needs to be given immediately. They all have to be given immediately. There is no time gap. Type 1 nothing needs to be given. Okay. Then a little bit about vitamins. You know that vitamin C deficiency causes scurvy. Okay. Then vitamin B3 is niacin and its deficiency causes pellagra, and this is characterized by 3D, that is dermatitis, dementia and diarrhea. Okay. Then vitamin B6, which is pyridoxine, and pyridoxine deficiency occurs when the patient is on INH. So INH TB patients are given pyridoxine, right? Then pyridoxine reduces the effect of L-DOPA, so that is something important. And pyridoxine plus doxylamine is given as a antiemetic in morning sickness. It is approved. Okay, so this is something about the vitamins. Then we have the last part of this miscellaneous, that is vaccines. Vaccines are of two types. There are killed vaccines and there are live attenuated vaccines. Now killed vaccines are bacterial as well as viral, live attenuated are bacterial as well as virus. Then we have toxoids, and then we have combined vaccines also. So let's see the vaccines one by one.